Hello, I'm Dr. Beech, and today I want to talk a little bit about TMJ, or temporomandibular joint. Patients are often not aware that we can, as chiropractors, treat TMJ. So TMJ means the temporomandibular joint, and that's the joint that connects the jawbone with the skull here. And as the TMJ opens and closes, you're actually dislocating the joint. There's actually a fossa, or a little place that the bone fits into, so that when you open the mouth, that joint dislocates, it opens up, and then when you close it, it goes back. There's actually a disc in there that cushions that area. And TMJ dysfunction is very common and obviously treated by dentists, and I do recommend TMJ treatment by dentists for more severe problems. But I would say in about 50% of the time in patients that come in to me, we can correct the TMJ dysfunction as long as there's not a lot of deterioration in the joint. If the joint has just become dysfunctional, so that when the person opens and closes, many times what will happen, they'll open like this or close with a delay, or open like this and close with a delay, instead of this nice even opening and closing. And that can easily be corrected by manipulation of the jaw area, which is a very simple, easy thing to do. It doesn't hurt, and it gives like instant relief of TMJ discomfort and reduction of that problem with the joint opening and closing. So if you have TMJ problems, some of the symptoms that go along with it is not only jaw pain, but many times headaches, neck pain, even sometimes back discomfort, because the TMJ actually is intimate with so many different areas of the nervous system that it can create what's called TMJ syndrome, which can create a lot of problems. And sometimes the TMJ problem is coming from other sources. Sometimes it's not really the jaw itself that's the problem, but it might be the upper cervical area that's the problem. It might be some myofascial problem in the muscles of the neck, or in the muscles of the temporalis area, or in the jaw area. And so there are some other techniques that we show patients for relaxing the muscles around the jaw, the muscles here. Sometimes we have to do cranial adjusting or upper cervical adjusting in addition to treating the TMJ area. Everybody's an individual, so we have to evaluate you and see. Now, if you get something where your jaw is locking up, like opening and then not wanting to close, or vice versa, that problem is more significant than what I can typically treat. Usually I refer out to a TMJ specialist, a dental specialist, for that type of thing. But if you have any questions, then call us and come in, have an evaluation. Let's see if this is something that we can treat. If it is, it's usually a fairly easy treatment to do and short term. If not, then I'll help you find the appropriate dental professional to go to for further care. Sometimes we do both chiropractic and dental care for TMJ. If we're finding that, say, there's a posture problem, many times a lot of forward head tilt will cause the jaw to jut out and create a problem. So now we've got a TMJ problem that is caused by a posture problem. So we can correct the posture, but if the TMJ problem is too severe, then we have to do work on the TMJ as well. So in that case, we do both dental and chiropractic work concurrently for that kind of problem. So if you have any questions, let me know, and I'll talk to you next time.